watching CNBC TV18.
Well, the big story this evening, the Supreme Court has directed the central government to place the rationale, copies of all relevant documents and file notings on its vaccination policy within 2 weeks. It's also said that prima facie it is arbitrary and irrational of the central government to conduct free vaccinations for groups under the first two phases, but replace that with paid vaccination by state governments and private hospitals for people in the age group of 18 to 44. Ashmit joins us now with more. Ashmit, take us through the details of the order. It pretty much echoes the observations that the court made during the hearings.
Indeed, this order essentially flows from the proceedings that we had seen earlier this week on Monday, when Justice Chandrachud-led bench had in fact heard arguments in the suo motu proceedings on pandemic management, and pretty much in line with the observations that he'd made, some key questions have been put across to the government. First up, the data about vaccinations, about inoculations, has been sought from the government. Clear data in terms of people who have received one jab, people who received two jabs. In fact, the centre has gone a step forward and said that we also want the data bifurcated into data with respect to inoculations in urban centres versus inoculations in rural areas. Keep in mind that there were observations made on Monday that there seems to be an exclusionary approach as far as centre is concerned on rural inoculation. So that was a key observation that Justice Chandrachud had made. Now, going further, the Supreme Court has also sought clarifications on the total vaccine procurement strategy in terms of, number one, the orders placed, number two, the expected date of receipt of that order of doses, and the third is the total quantity of the vaccines procured. These three data points will have to be clarified before the apex court. And finally, the Supreme Court has also sought clarification on when and what the strategy is, what the roadmap is for vaccinating the remaining population. Keep in mind that the Solicitor General Tushar Mehta, appearing for the government, had said that by December 2021 is when the entire population can be inoculated. That was a submission that he had made orally, not on paper, not on affidavit. What's also important is that the Supreme Court is seeking to verify a claim by the centre that all states will provide free vaccinations for the 18 to 44 age group. And towards that end, all states and union territories have been asked to place on record their respective policies on whether or not there will be any free vaccinations in the 18 to 44 age group. But what's important is that, speaking of the 18 to 44 age group, the Supreme Court in its order has observed that prima facie, the policy of the centre to provide free vaccination for the 45 plus age group and leave the 18 to 44 age group to the states to have paid vaccinations is prima facie arbitrary. So strong observations, those, and key findings in fact have been sought from the centre. The centre now has a 2 weeks deadline to come back and to clarify on all these data points that the apex court has sought.
Ashmit, many thanks for joining us. That is the Supreme Court's order in the matter dealing with vaccines, and the central government will now have to respond in 2 weeks' time. Now, as India witnesses a steady decline in fresh COVID infections, the call for a staggered reopening of economic activities is gaining momentum. Industry body FICCI has written to the government suggesting a blueprint for phasing of restrictions. The recommendations are based on the nature of the economic activity and the positivity rate in the area where it's being performed. Now, let's break this up for you. For manufacturing, FICCI has suggested allowing operations for both essential and defence goods in all regions without any curbs. For export-oriented units and continuous process industries, it suggests isolation bubbles in pockets with over 10% positivity rate. For other manufacturing units, the industry body is suggesting restrictions, free operations only in areas with less than 2.5% positivity rate. Let's talk about the services space. FICCI has suggested a resumption of all essential activities, including banking, communication and IT, with 50% manpower cap in areas with over 10% positivity rate. It's also suggested complete reopening of e-commerce for both essential and non-essential goods. In the retail and distribution segment, the industry body is recommending allowing pharma stores to operate without any curbs. For essentials, consumer goods, it's suggesting complete reopening where the positivity rate is below 5%. For regions with a positivity rate higher than 5%, FICCI has proposed limited hours of operations. However, for non-essential stores, the industry body has suggested permitting home delivery in such areas. It's also recommended allowing round-the-clock food delivery everywhere, but for dine-in, it has suggested complete reopening only in areas with less than 2.5% positivity rate. The industry body is also batting for lifting of curbs on alcohol delivery, logistics, warehouse warehousing and cargo movement. Well, joining me now to discuss the matrix that's been put together to ease restrictions is the president of FICCI, Uday Shankar. Uday, many thanks for joining us here on the program. You've submitted these recommendations, this matrix that you've put together to the government, to Minister Piyush Goyal. I want to understand from you the process on being able to put this together. I would imagine consultations with industry, but also with epidemiologists and other experts. How did you arrive at this matrix?
So there is a lot of work that's gone into it, Shireen. You're exactly right. We spoke to all our members. We spoke to a large number of experts. We've also picked up what the various state governments and the union government has done in this round of the second wave of COVID, and also last year. And we overlay on that the whole idea of the whole principle that we need to try and revive economic activity as far as possible, so that we are not, the economy, we strike a good balance between lives and livelihoods, and the economy does not suffer if we can avoid that without compromising safety and lives of people. So based on that, this is what we have done. And as you can see, the principles are very clear, that we are saying that if it is below 2.5% of positivity rate, that is when a large number of activities can come to normal. But even then, we have recommended very strong vigilance. We have recommended extremely high levels of testing at unit levels. And we've said that there is a need to disaggregate the infection rates, so that we know, we look at it at smaller clusters across the country, and we don't wait for an aggregate spike to happen before we start responding. We've also said something very, very significant, that reopening does not mean relaxation or relief from COVID. Relief from COVID will only happen when we have a large part of our population that is vaccinated. But we've seen that last year the wave came, we reopened, again there was a second wave, and there is talk of a third wave. We are all praying that it may not come to that. However, we have to be ready. But on the other hand, we cannot keep the economic engines totally shut for all this time. The price that the country is paying, and the same citizens who are suffering from COVID, we don't want them to suffer from the impact of a shut economy. And that is why the whole principle of responsible economic activity without compromising the health and safety issues.
Yes, you summed it up nicely, responsible reopening, and I think that is what states are also looking at this point in time. And of course, there is that Home Ministry's containment guidelines that states will also need to comply with as we move forward. Those are in place till the end of June. But, Uday, what's the feedback that you're getting from your members in terms of where things currently stand for business confidence? Even if we were to reopen, unlike the last wave where, the view was that as soon as there was a reopening, there was this pent-up demand that drove up consumption across different sectors. What is the sense that you get this time around from your membership?
So we released a business confidence survey last week, and the findings are, not good, as you can imagine.